Kuphina kuphi emakhaya amadolobheni asekomplasta khona lapho kubukele khona SABC 1 sesingenile ke thina mavulandlela nehlelo lakho ilungelo lakho, it's your right. Silethela ke lohlelo lapha kumahamba phambili SABC 1 Mzansi for sure. Mina ke bekunene ngingisimpiwe ngcongwane. Hayi bantu bakethu, sifo se-COVID-19 sesihambene nemiphefumulo leminingi, kepha ke kusakhona abantu labangafuni ukujova ekutheni bavikele leli bhubhane le-COVID. Ngekuthi ke bevatini for letiningi letingasilo ke liqiniso naletisabisako ngehlelo ke lekujova phecelezi i-vaccination. Ingabe sakho ke sizathu sekusaba kujova yini? Mbukela asisingene shaka endzabeni yethu namhla. Sive ukuthi ingabe kungani ukuthi ke kubaluleke ukuthi ke bonke abantu eNingizimu Afrika bajove. Not even the growing number of COVID-19 related deaths seems to be encouraging some skeptics to inoculate. Fake news, myths and fear-mongering and conspiracy theories spread all over social media seem to have kept some people away from vaccination queues. But will the picture change as calls increase for the vaccination drive to be brought forward to the younger age groups between the ages of 18 and 34? Well, to tell us more about this, we will be welcoming our guests on the show. Sitabeke sinaye Jane Simmonds, lomeleke South African Medical Research Council. Siphinze sibe na Dr. Noluthando Nematswerani, lokhulumela ke i-Discovery Health khona ke lapha ehlelweni lethu ke siyathemba ukuthi ke tinintethu ke setilungisela ke ukuthi ke tibe nathi ke ehlelweni nanfu. We certainly hope that our guests are preparing to join us this afternoon. Remember that the number to call is 011 they're on the screens right now, 011-714-6918 noma ke 011-714-6919. Usichazela kabanti ukuthi yini lokuvile nge-COVID-19, yini ke lokuvile ke nge-vaccination noma ke phecelezi ukujova, nekuthi ke yini ema-myths noma ke itinto tingasilo liqiniso lokungemanga, ngoba ke lokho ke kukhunyabeta ke umgomo wahulumende nehlelo lwahulumende lekujova i-vaccination drive, ngoba ke abantu bayivatini vele etinengi lingasilo liqiniso kuthiwa ke lento kubusathane lento ekujova, labanye ke bathi kujova indlela yahulumende ukuthi anciphise i-population. Tinto ke lesingasati lesingadadi letingasilo nani liqiniso. Namhla ke bekunene sitawukhuluma ke ngako lokujova nebumcoka bako ukujova nekuthi ke bobani ke lekumele ukuthi bajove ke. Uhulumende ke swene tinto tabalula ekutheni wonke lo ilunga lalomphakathi i-South African citizen ajove, ngoba yakhumbula sibacala ngabogogo those who are over 60 bayangekuya ke all the different age groups. Nyalo ke sekuthiwa ke bonke labanaminyaka long-18 to 34 sekumele ukuthi bajove. So namhla ke sitawuva kabantu ukuthi ke yini lokuvimba ukuthi ungajovi, ungaregister futhi ukuthi ujove, nalabanye ke labatawukhuluma ke manga ukuthi na ungafuni ukujova kutawendekana, na ujova kwendekani. Cha, lokho bekunene sitawuzama ke ukundlala sinichazele kabantu ukuthi ke umcoka ngani ukuthi wonke umuntu ajove kuze ukuthi ke live lonke liphephe kuleli bhubhane le-COVID-19. I do understand that our guest is ready, Jane Simmonds. Jane, a very good afternoon to you. Thank you so much for joining us. Welcome to the show.
Thank you for having me.
All right, now, Jane, so much has been said and so much has been done about the ongoing vaccination drive here in South Africa, but it got off to a very shaky start with the vaccine hesitancy, with so many people being hesitant, with so many people, imbibing and indulging in these fake news and, hoax stories around the vaccination. How much of a deterrent has it been in the government's ongoing vaccination drive?
So I think that fake news and disinformation and social media and negative press coverage has played a role. But I don't think it's playing as big a role as we think. So if we think that a lot of South Africans are in fact not on social media and do not follow social media, especially in the older and more rural communities. So I've been part of a study that's been run by the South African Medical Research Council, the Human Sciences Research Council, and the Serenia Public Health Trust. And we've been looking at what we call vaccine hesitancy. But we've almost started to change the word from vaccine hesitancy to vaccine resistance, or barriers to vaccine. Because we're finding that by calling something vaccine hesitancy, you're giving an individual, or you're blaming an individual for making an individual decision that I'm not going to get a vaccine. Whereas we feel in South Africa, there are a lot more reasons why an individual doesn't get a vaccine. They don't choose not to get a vaccine because of a religious or cultural or other reasons, but it's an issue of access and barriers to getting vaccines. Where are people getting vaccines? How much does it cost to get to a vaccine? How do you take time off work? Where do you find childcare minders to look after your children when you go to get a vaccine? How do you actually get a vaccine? So I think the biggest barrier is actually accessing vaccines, not an individual choice to not get a vaccine.
And apart from the accessibility of vaccines, as you've just rightly mentioned, what drives this hesitancy, though?
So if you look at fake news and social media, there are a lot of stories out there. And of course, people like to look at the negative stories. They like to look at the story where there is a scandal or an excitement. And newspapers like to cover that, and the TV and news likes to cover those stories. And we also need to look at the role of the press, and thank you for this opportunity to talk about it, and TV. But I think most importantly, we need to look again, as I've said, as to barriers to access. What are people doing to get to vaccines, and how is it possible for them to reach them? How many people, if you knocked on their door and said, here's a vaccine, would say no? Compared to how many of those same people would get into cars, get onto buses, get onto trains, get into taxis to go and get that vaccine at a vaccine center.
And I see that the vaccination drive is going on smoothly for the different sectors in the various areas and the different provinces. And I see that so many private companies are opening their doors for more people to be vaccinated as part of the private-public partnership between government and the various stakeholders. But what are some of the challenges, if at all, have the stakeholders encountered in this drive?
Well, I've been part of an initiative where we decided to take vaccines to the social grant queues, to the SASSA queues. Because when we are looking to vaccinate over 60-year-olds, you have to think, where are the 60-year-olds? This is a challenge. Where are they? They're not at work, they're not at school, they're not on transport, they're not in churches. Where are they? Some are in congregate settings in old age homes, but very few. Most of them are at home. But we do know that 4.2 million South Africans over 60 get a older person's grant, and this gets paid out at the beginning of each month. And most of these people get these grants from retailers, banks, and the SASSA mobile grant queues and the post office. So we partnered with the retailers, Boxer, Massmart, ShopRite, Pick n Pay, Spar, and we've rolled out vaccine sites in these stores with the retailers. We've done this with support of Solidarity Fund, of Business for South Africa's funding. We've got MTN and Vodacom on board to send SMS pings where they will send a message out to every cell phone that's attached to the cell phone mast closest to the vaccine site to say that vaccines are happening. We've worked with the cash and transit truck companies, G4S and Fidelity, to distribute information to grant queues to where people are. So what we're looking at is, where are people and how do we get the vaccine to people? But even in these grant queues, people are queuing to collect their money. They're not queuing to collect a vaccine. So you can offer them a vaccine, or you can offer them the money. They'll take queuing for the money. Yeah. But by the most important thing is to look at where people are and to take the vaccine to them.
Okay, Jane, please stay on the line. We'll certainly continue with this conversation in a moment. But for now, let me also welcome Dr. Noluthando Nematswerani from Discovery Health. Dr. Noluthando, sagumuhle sawubona.
Sawubona Simpiwe. Thank you for having me.
Siyakumulela kakhulu ehlelweni Dr. Noluthando. Sesikhulumile ke abantu na Jane ngenzaba ke nganakuthiwa ke i-vaccine hesitancy noma ke kungabada ekutheni bantu bajove as a result of so many factors such as fake news, misinformation, disinformation. Ngekubuka kwakho ke Dr. Noluthando, lo mgomo noma ke luhlelo lahulumende lekujova lihamba kanjani? And these fake news, how much of a deterrent has it been?
So leli hlelo lomgomo, I think belihamba kahle. Siyasajabula kakhulu masithola ama over 35s enroller, sajabula kakhulu sabona very high numbers, especially just before baqale ukugoma. But into esibonayo ngoku ukuthi amanani ayehla. So indawo lezi apho abantu ba-vaccinate khona, isikakhulu masibheka kulezi ndawo thina ke in the private sector, sithola ukuthi abantu abasezi ngalela indlela bebesiza ngayo ekuqaleni. So si worried ukuthi ingathi lokhu kungabaza sekukhona ebantwini. And I think masibheka ukungabaza kuza ekuthini abantu balalela kakhulu izinto ezivela ku social media, balalela kakhulu izinto misinformation, you know, izinto ezingaphrovwanga anywhere, bathi abantu bayafa bebulawa ukugoma, abanye bagoma namhlanje kusasa umuntu uvuke eshonile. So abantu balalela zonke lezi zinto ezingeloqiniso. So I think kusekuningi that we need to do ukuthi abantu sibanikeze the real you know, the right information so that they can be equipped with information ezobasiza ukuthi benze izinqumo, you know, but decide ukuthi bayahamba bayo-vaccinate. Ngoba if aba-vaccinate abantu abaningi and siyazi ukuthi i-COVID yabulala, kuzoba nzima ngokuthi abantu abaningi abagulayo abaphethwe ngo-diabetes, lento isifo sikashukela, i-high blood pressure, ngabantu esibaziyo ukuthi if bagula baphathwa yi-COVID balala esibhedlela, abantu abakhulelwe, you know, iziphumela or imiphumela mabeye esibhedlela ayibi mikho mihle, abanye baphela sebeshonela lapha esibhedlela. So ukuvaccinate kubalekile, ukugoma yeyona nto esithi yeyona into abantu kufanele ukuthi bayenze ngalesi sikhathi.
Okay, Dr. Noluthando Nematswerani, please stay on the line ngoba sitawuchubeka nenkulumo yethu. Ngifuna ukuthi emva kwaleli khefu sikhulume kabanti ngalethi inhlobonhlobo temijovo ngoba kunabo Johnson & Johnson, kunabo Pfizer, nato tonke inhlobonhlobo, nekuthi ke ngiyiphi ke inhlobo lekumele ukuthi bantu bayijovele. Please stay on the line and we'll certainly touch base with you in a moment. Ake mbukeli kwanyalo asesesishelela ngasetitolo. Please stay with us. We'll be back right after this. Leli Yilungelo Lakho, don't go away. Welcome back. Tincingo tethu ke sesivuliwe ukuthi nawe ungaba ingcenye yale nkulumo yethu namhla. Ungashayela kucingo ke 0117146918 noma ke 0117146919. You can also email your thoughts to consumer@sabc.co.za or interact with us on Facebook, and I'll be sharing some of the Facebook messages that have been coming through because there's so much interest ngalenzaba ke ukujova noma ke ukuvaccinate kujovela ke i-COVID-19, and there's various myths and conspiracy theories and fake news, misinformation, disinformation. Namhla ke bekunene sitawendlala ke facts namaqiniso ke alenzaba ukuthi kahle kahle lokungiko ngikuphi. Sinabochwephesha ke batasichazela kabantu ukuthi kucwangani ukuthi wonke ajove la eNingizimu Afrika kuze ukuthi wonke umuntu aphephe. Namhla ke sina Dr. Noluthando Nematswerani from Discovery Health. Siphinde sibe na Jane Simmonds. She's a research manager at the South African Medical Research Council. Now Jane, please stay on the line. I'll certainly touch base with you in just a moment. But Noluthando, ngifuna ukuthi sichubeke kabantu ngenzaba yethu lesingakayiqedzele ke singakayi elkhefini. Kuthi ke kunethi inhlobonhlobo ke te vaccine noma ke tatale mijovo, kunabo vaccine, kunabo Johnson & Johnson, kunabo Pfizer. Kuthi kumcoka yini ukuthi abantu babuke lokuthi bajova muphi umjovo noma ke wonke nje umjovo uyafanana?
I think kubalekile ukuthi uqala abantu bazi ukuthi i-vaccine isebenza kanjani. Ngokuthi if useyazi ukuthi isebenza kanjani, then sizokwazi ukuthi izohluke kanjani i-Pfizer ne Johnson & Johnson. Masinikeza i-vaccine andithi siyenzela ukuthi amasoja omzimba abe trained so that ngalesikhathi sowuthola i-infection ye-COVID sele uready ukuthi ulwe, enzela ukuthi umzimba wakho ukhone ukuba uphole ungabulawa yi-COVID. So indlela esebenza ngayo i-Pfizer ukuthi ifaka something la kwi-DNA, kunzima ukuthi ngicacise, kodwa ibizwa i-mRNA vaccine. So indlela esebenza ngayo sikunikeza i-virus, i-COVID engaphiliyo, iphisanyana yakhona enza ukuthi umzimba wakho utraine lamasoja omzimba ukuthi ngalesi sikhathi sohlangana ne-COVID ube so ready. Ngokunjalo i-J&J isebenza ngokufana, mara kusetshenziswa indlela eyohlukile yokungenisa le virus engaphiliyo emzimbeni wakho.
Okay, Dr. Nangabe kuthiwa ke le clinic lena ijova nge-Pfizer noma nge-Johnson & Johnson, ngingakunaki lokho ngivele nje ngiregister ngihambe ngiyojova.
Ungakunaki Simphiwe ngoba nangona zisebenza ngendlela ezingafani but zenza umsebenzi ofanayo ukuthi sitraina lamasoja omzimba enzela ukuthi mase ukhona ukuthi uthole iCovid sele ukwazi ukulwa enzela ukuthi ungabi nasifo esizokubulala or isifo esizokulalisa esibhedlela. So it's very important. There are very, very rare circumstances where abantu bangazukhona ukunikezwa umjovo othile. Mabengakhona, let's say kukhona iphathi yale vaccine abangazwani nayo apha sithe severe allergies, umuntu une-allergy serious kulo mjovo we-Pfizer okanye we-Johnson & Johnson. But ngalesikhathi ngikutshela ngakhona it's very rare. Ayijwayelekile. So abantu abaningi, you can go to any clinic. If uthole i-J&J kulungile, but kufuneka wazi kumahluko phakathi kwe-J&J ne-Pfizer ukuthi Pfizer yona uzojova kabili whereas i-J&J ujova kayi-1. Nanko nje qha umahluko nokuthi ke if kukhona like a very rare circumstance lapho udokotela wakho akutshela ukuthi hey wena ugula ngale ndlela le vaccine ayizukulungela, that's the only reason ke bazokutshela ukuthi okay wena ungeze uthole i-Johnson & Johnson uzothola i-Pfizer. But for abantu abaningi la emphakathini, it's safe to use any of the two.
No, Dr. Noluthando, kunanako ke labathi labafunzile yi-vaccine hesitancy noma ke kungabatela ke lo mjovo. Lokho ke kubangelwa ke tindzaba letiningi, tindzaba tabo fake news netinfo lesingadati netinfo ke letingasilo liqiniso letide nobufakazi bako. Labanye ke bathi indlela ke yemhlabhlangene noma ke hulumende in the different in the different sectors ukuthi ke banciphise ipopulation yalapha emhlabeni. Labanye ke bathi lokho emjovo kusayi magnet ngoba khona ke ama video bengiwabona la ku social media abantu bathi nabaceda ukujova nababeka imali la ivele inamathele lokusho kona ukuthi kuyimagnet lokwemjovo lokusho ukuthi akulungi akuyilungeli imitimba yethu. So ngicela ukuva ukuthi hulumende yini umsebenzi angawenda, what more can government do in terms of lessening the fear ukuthi bantu bachubeke bamba bawujova?
I think ukukhuluma zona ke Simphiwe ngoba sonke siyazibona lezi videos zicirculate ku social media. Into abalekile uhulumende na ukuthi makayenze ukuthi aveze iqiniso in terms of ukuthi i-vaccinations zenziwa kanjani, ukuthi zitestwa kanjani, ukuthi zisafe kangakanani na. Lo information ibe lapha yana ebantwini ukuthi abantu bakhona ukuthi bayibone. And futhi I think kubalekile ukuthi nathi thina sijovileyo sibabonisa ukuthi akukho magnet ehlalayo la. So I think it's up to us as communities ukuthi sibonise thina abantu sebe vaccinate ukuthi ngempela azikho lezi zinto ezilapha ku social media. And I think advocacy is important and nokuthi nalapha emphakathini abantu ababhekelwa phambili babe ngabo abahambisa le miyalezo yokuthi i-COVID vaccination iyasebenza inceda abantu and lezi zinto abazibona ku social media akho qiniso kuzo. Ngokuthi I think i-government ingasebenza ithumele imiyalezo as much as government can, but I think at the end of the day nathi kuma community ethu fanele ukuthi sithathele kuthi indaba yokuthi we must educate abantu abasenokungabaza so that sibabonisa ukuthi siphilile and akukho magnet ihlala yakho 5G activate weyo. So I think zonke lezo
speaking of community awareness, Dr. Noluthando, kubaleke kanjani ukuthi ke bantu noma ke malunga emphakathi alalele emavi lathembekile the stronger voices, especially the community leaders, kuze ukuthi ke baqhubeke baspread lo mlayeto ngekujova?
Yeah, sifuna kanye lokho ukuthi aba community leaders abasesontweni abafundisi sifuna even abodokotela abasebenza lapho kulo miphakathi sifuna wona lawo mazwi athembekileyo ukuthi bengawo akhulumela phezulu ngoba manje siva lamazwi angenaqiniso ingawo angathi akhulumela phezulu. So I think it's very important ukuthi nyani ibe ngaba abantu abakhuluma iqiniso nge-vaccines, not laba abahambisa i-information engekho engenaqiniso. So I think it, like I'm saying, it takes it's a responsibility of everyone. It's not only urhulumente ofanele ukuthi enze lokho. Kufanele ukuthi sonke sithathele ukuthi nami kule ndawo endikuyo emphakathini wami kufanele ukuthi ngifundise abantu ngibatshele ukuthi mina ngivaccinatile yini eyenzekileyo kum. Yebo ngivaccinatile ngaba nekhanda ngava ingathi umzimba wami uyagodola ngeva umzimba wami ngathi uyashisa mara lokho kuthatha insuku ezimbini sengipholile and then after that sengikhuselekile in case ngitholana ne-COVID. So I think kubalulekile because abantu bayesaba ukuthi ngizogula kakhulu mangithole umjovo kungcono ngivele ngingayi ngoba ngizobulawa i-vaccine. Kubalulekile ukuthi sazi ukuthi i-vaccine ayibulali but i-COVID iyabulala. And singabonisa ukuthi naba obani nobani abashonile bebulawa i-COVID mara asikhoni ukubonisa ukuthi lo muntu ujovile wabulawa i-vaccine. Abantu bayagula ngalesinye isikhathi uthola ukuthi umuntu uye wayojova kodwa bese iphethwe i-COVID ngalesikhathi eyojova. Manje iba ngathi uguliswe ngumjovo kanti hayi ebese igula vele before ajove.
Yeah, kungako vele kumqoka kakhulu ke lokuthi abantu batheste so that bathi bayojova nje sebadi ke status noma ke simo sabo ukuthi ke bamephi banayo le COVID noma bede ngoba phela ngivile ngandlebenye ukuthi vele ugula kakhulu nangabe ujovile kanti unayo vele le COVID kubonakala ngathi vele uguliswa ngilomjovo kanti uguliswa ngilo COVID. Asishiye lapho ke Dr. Noluthando sitawuphika sichubeke nomkhulumi wethu emva kwaleli khefu and I'll also touch base with you Jane Simmonds after the break. I want us to talk a bit more about the side effects or the ostensible side effects as a result of this vaccination drive that is currently going on. Please stay on the line. We'll certainly touch base with you after this break. Mbukeli asasithi shelele ngasitolo unganyakati sawuphinda sibuye khona nyalo. Welcome back. Sakumolo futhi mbukele. Namhla sikhuluma ngebantu labasaba ukujova noma ukujovela ngesifo se-COVID-19 ngekuthi ke beva tinfo letiningi lethi ngasilo liqiniso naleti sabisako. So siyabakhutsata ke abantu ukuthi abachubeke bajove. Lokumcoka ukuthi ke sibakhutsata kanjani abantu ukuthi bajove. Ingabe yini ke sizathu nawe ke lonaso sekutheke usabe kujova. Sishayela ke licingo ke ku-011-714-6918 noma ke 011-714-6919. Sitfole futhi na ku Facebook and speaking of Facebook we've got various social media messages and I'll be sharing some of them in a moment, but for now let's take our first caller. Sinathemba ulapha mtubatuba. Sakumolo ehleni sabona.
Yebo sabona bhuti njani?
Siyaphila khulu baba. Khuluma nathi baba. What's on your mind?
Sikhona. Hayi bhuti yazi abantu basaba lokujova nje ngoba babukela emumva emlandweni and uhulumeni akakazi enze into engakanani ukuthi
Okay, we seem to have lost Themba there. Ngisengamva kahle ke Themba ukuthi ukhuluma uthini. Kepha ke ngiyathemba ukuthi my colleagues will try to re-establish connection with him. But as they are busy doing that, let's take a look at some of the Facebook messages. Uthi ke Lulekwa Mfazwe uyabuta ke uthi, is it true that if you do not vaccinate you'll be restricted kungena ke kwamanye amazwe? If that is true, why kusitwa it is up to you to vaccinate? If you do not feel like vaccinating, do not do it. Logo it touches on the rights whether to vaccinate or not. It remains a constitutional right according to the president. Winsin uthi yena ke, good afternoon Msasazi. Mina ke I'm scared. I'm a chronic patient and I also have a heart condition. Is the vaccination safe for me? Eltin uti, yes, myself and my girlfriend, for those who think it's not safe, they should Google or ask about the vaccine from the healthcare center or even by the people nearby whom have already received the vaccine. There's nothing to worry about. Now, Jane, I'm sure you've been hearing some of these Facebook messages, but just a bit of a translation. Lulekwa says, is it true that if you do not vaccinate, you'll be restricted to travel abroad or to travel to other countries? And I guess it borders on the right, on the issue of the right of people to vaccinate. So what's your thoughts on this?
So people obviously do have a right to choose whether they're going to get a vaccination or not. But, most people take their children to get vaccinated at clinics when they are born, and most children get vaccinated. So what's new about this is we're asking adults to get vaccinated. Adults are not usually vaccinated, but vaccination is not unheard of. And for some countries where you want to visit, you have to get a yellow fever vaccination, and you can't go to that country without a yellow fever vaccination. So yes, you at the moment cannot travel overseas without a vaccination unless you go into quarantine or isolation at hotels. And this is probably going to be how the international community is going to move, is that you can travel if you're vaccinated, and if you're not vaccinated, you need to travel and stay in quarantine for 2 weeks in a hotel to make sure you haven't got COVID. So I think that just in terms of what your other comments are saying is that, you know, vaccines have been tested and trialed and researched, and we have a really good institution and a research organizations in South Africa, and these vaccines have been shown to be safe. And I don't speak much Zulu, but I did hear the doctor saying that you can die from COVID, but you don't die from the vaccine, and she's absolutely right. And you know, it's very important that people weigh up the advantages of getting vaccinated when you can still possibly get COVID, but you won't get it badly, and you probably won't go to hospital, and you definitely won't die, because that's what the research is showing, versus not getting the vaccine where you could get sick. You could get very sick and land up in hospital, and you could die. So that's really the choice that needs to be made. And there are some side effects. We know. I got the J&J vaccine, and I got terribly sore bones in my legs, and I felt terrible for about 3 or 4 hours. But since then, I've been absolutely fine since April, and I have not yet got COVID. So I think it's very important that people look at the responsibility about getting vaccinated. It's not only about us. It's about the whole world. And as the WHO says, we're not safe until we're all safe. So this is you know, we eradicated polio, but everyone got polio drops.
Yeah.
This is an opportunity and a responsibility to do the same.
Yeah, just picking up on that point that we are not safe when everybody is safe. I mean, there's various schools of thoughts on this particular matter. In as much as some, you know, vaccine hesitants or the vaccine skeptics reserve the right to choose whether to vaccinate or not. And some other companies and institutions say that everybody needs to vaccinate. Well, not that they are forced to, but they're trying to protect their employees. So in as much as they are right, I mean, there's different contestations with regards to what should be the status quo.
This is going to be a very, very interesting legal battle or legal issue about your responsibility to your workplace versus your individual responsibility. I can choose to smoke, but I'm not allowed to smoke in my workplace, and I'm not allowed to smoke in public because it's been deemed that smoking is dangerous to other people. Now, I'm not saying that the same holds true for COVID, but COVID is dangerous to people. So there is going to be discussion and debate about an individual's responsibility not to pass COVID on by getting vaccinated.
What about the reports of side effects? Because we certainly cannot ignore those. We've seen people dying in India and in the United States after taking this jab. So this is something that we can't ignore because we've got different bodies, and our bodies react differently to various medication or vaccinations that's been ingested into our bodies. So what about the issue of side effects? Is that likely to drive the hesitancy even further?
I don't think it should. And I think what we need to do is we need to be honest about communication with South Africans, and government and doctors and community leaders and traditional leaders and healthcare workers and teachers and people who are leaders in communities need to be honest, and they need to be informed. Yes, there are some side effects, but these side effects are usually not severe. And I think it would be important for the doctor to answer this as well. And that very, 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 very few deaths have been linked to the jab directly. And, you're looking at millions of people who've been vaccinated, and it's not dangerous to get vaccinated. Okay. But we can't deny the side effects because they do exist. But it's a headache or sore bones or feeling feverish or nausea. But I'd like the doctor to answer the question in terms of the side effects as well. Okay.
All right. And Jane, please stay on the line because we'll take our first caller. He might have a question for you. We have since re-established connection with Themba Mtubatuba. Sagumure Baba Sawubona.
Yebo sawubona baba. Ayila ukuthi into eyenzekalayo la uyabona singabantu bomlando thina siyabuka ukuthi into isukaphi kanjani yabo. Uyabona njengamanje into eyenzekile kufike kwathiwa lento ithatha abantu abadala. Ithatha abantu abancane. Manje ne-vaccination le iza futhi ngegaba manje lento yenza singaqondi kanti uhulumeni wahamba imigodi kwathiwa umva amathuna ukuthi iyeza lento izobulala abantu so asiqondile le ndaba ye-vaccination kumanje kade le ngoba ngama-Olympics le kuphi sibone ama-China uthiwa ngazi noma ama-Japanese or ama-China nami leyo ndaba ngayibuka ngihlule bathola ukuthi badisqualifyile ukuyodlala through ukuthi lento banalento kodwa manje sebejove kayi-2 bathi bajove kayi-2 kodwa still banayo lento so manje lento yenza ukuthi ube nombuzo eminingi
so wena bakuthemba sowujovile wena so-vaccinatile
ya ngivaccinatile mina.
Okay, so letinto lekukhulunywa ngato utivile noma uti-experiencile ukuthi kutawendeka na ujovile?
Ngikhuluma ngezinto engizibuka mina kwi-TV endabeni ukuthi into vese khona akusiyona into engiyithola mhlambe engiyithola ku-Facebook or mhlambe ku-Twitter cha.
No, sengikhuluma ngawe ke babethemba ukuthi ke na uceza kujova utive unjani nje emtimbeni?
Hayi, ngiyafana nje ngizomehluko manje.
Okay, all right. Babthemba siyabonga kakhulu ke kusishayela. Dr. Noluthando, please stay on the line. We'll certainly touch base with you. I want you to pick up on the point of side effects, the point that has been raised by Jane Simmonds, after the vaccination. Bugeleke, let's pause there once again for yet another commercial break. Clara genatsi ngongasanyakadi. Asinamukela kubeknene ehleleni Yilungelo Lakho, it's your right. Ungasishaya ke licingo ku 0117146918 noma ke 0117146919. These are participation lines. What's your take on vaccination? Why would some of us even hesitate to vaccinate? Shaya licingo ke uvakalisa umbono wakho nesichazele kabanti ukuthi nangabe uyesaba kujova yini lokwenda ukuthi usabe kujova ngoba ke namhla ke sitawendlala onke lamaqiniso ekuthene ke kumcoka ngani ukuthi wonke ajove. Sinabo ke bochwephesha batasichazela kabanti kulolu hlangothi. Let's take our next caller. Sinam lapha ke sibokeni sawumele ehleleni sawubona baba.
Sawo simphiweni njani baba?
Siphilile baba kunjani and please share with us what's on your mind.
Asithi baba. Baba into engikazayo mina nayi la abanye uthiwa uhlaba kayi-2 and then uhlaba kayi-1 manje angazi ukuthi kahle ukuthi yiphi e-right yiphi engekho right ngoba abanye mabaqeda ukuhlaba umuntu uthi ngathi uhlangana nekhanda manje angisazi kahle ukuthi na yini okumele siyenze thina abantu abamnyama ngoba noma ngamele ukuthi umuntu makafuna uyaya wehlaba o angayi kwehlaba manje sokuthiwa nona nasezitolo ezinyawungeni ongajovanga manje asazi ukuthi na inkinga yiphi.
Okay Mthimkhulu sabonga kakhulu ukusishayela ke Dr. Noluthando ngiyathemba umvile ke Mthimkhulu lapha uyabuta lokuthi ke nguphi umjovo lokumele ukuthi njoba besichazile ngaphambilini ukuthi ngumuphi ihlobo lemjovo lekumele ukuthi siujovele ke yena ke uyabuta ukuthi leminye imjovo ujova kanye leminye ujova kabili nekuthi ke na ujove umjovo lotsite angeke ukhona ukungena endzaweni letitsite noma ke utakhona ukungena endzaweni letitsite kenabe ujove ngemjovo lotsite so asusichazela kabanti kusendlalele ke lama facts ukuthi ke nguphi lokungiko.
Alright, ngiyabonga kakhulu Simphiwe. I think ngizobe sengithathelela kulapho uJane ebeshiye khona ngiphendula umthimkhulu ngiyafuna nophendula ubhuti uThemba umbuzo wakhe ngoba ngumbuzo obalekile kakhulu. So ama side effects mawuqeda ujova ajwayelekile and mawuphuma lapho uqeda ujova uyatshelwa ukuthi yabona manje ujovile ungazizwa ingathi uyashisa ungazizwa ingathi uyagodola ungazizwa unekhanda ungazizwa ingathi ukhathele abanye ama joints abhlungu abanye bathi ekubhlungu umqolo mara siyazi ukuthi lama side effects lawo ne alasta 1 day 2 days umuntu upholile and siyakutshela mawuqeda ujova sithi thatha maybe amapanado ukuthi nje ukuthi ikhanda lingabikho bhlungu. And abaningi kakhulu abantu abajovileyo that's why bengisitsho ngisithi nami ngajova ngaba nekhanda ngazizwa ngingathi ngiyashisa ngazizwa ngathi ngiyagodola ngaleyo ndlela kuyabonakalisa ukuthi umjovo uyasebenza bakhona abanye abantu abangezwa lutho ajove angezwa lutho akusho ukuthi umjova awusebenzi for yena mara kutsho ukuthi nje imizimba yethu ireacta ngendlela ezingafani but abantu abaningi siyazi ukuthi bazoba nawo ama-side effects manje kukhona lama-side effect as-serious la apho if abantu bayakhumbula kokuthiwa uyaklotha manje igazi lakho liyaqina umuntu then angabikho right abe nakhanda elikhulu I mean ikhanda libe buhlungu kakhulu kube khona ama-chest pain la esifubeni kube buhlungu lapha esiswini kube buhlungu imilenze ibe buhlungu mawunalezo i-side effects sithi hamba uyobonana nodokotela wakho ukuthi ucheckwe ukuthi awuna side effect lezi ezithi aziqhelekanga and azikho njalo ziba khona in a very few people in we say 2 to 11 in a million meaning that abantu abaningi abangeze bazithole lezo kukhona nabantu esithi banama allergies uyabona ukuthi wena phuze imithi umzimba wakho reacta ngendlela ethile so siyazi ukuthi bakhona abantu abanama allergies as very severe to i-vaccine labo bantu labo mawuyojova first kufuneka ujove endaweni lapho bazokhona ukuthi bakumonitorishe abantu abanama allergies kuthiwa sibamonitorisha at least for 30 minutes njengokuthi abanye abantu after ejovile sibamonitorisha only for 15 minutes but
ukuthi lama side effects are temporary angeke aze last over a long term period.
No.
Okay.
Ama side effect, like in situ, 2 to 3 days. When they last longer than 3 days, that's when we say go and get checked, and it's usually the severe ones. But even those, they are treatwa and they abantu babe right. So kubalulekile ukuthi sazi ukuthi nalama side effect esithi serious, gama side effect nawo akwaziyo ukuthi siwa treat ukuthi abantu baphole. But awajwayelekanga kubalulekile ukuthi sitsho ukuthi akajwayelekanga.
Okay, Abraham, GERMISTON, please stay on the line. I'll come to you in the next couple of seconds. Kepha nje ngifuna ukubuta nawe Dr. Noluthando ukuthi ke bomake ke labakhulelwe nalabo ke labamunyisako bangajova bona.
Yebo mabajove and lapha eSouth Africa sithi if uqede i-trimester yakho if usowugqithe i3 months ye pregnancy so after 14 weeks hayi sithi hamba uyojova ngokuthi esikubonayo ukuthi abantu aba pregnant if bathole i-COVID bayashona ngoba bagula kakhulu bona mabe thole i-COVID ngokuthi imizimba yabo ayikho strong kakhulu ukuthi ingalwisana ne-COVID which is why sisithi bajove so that bazoprotect from isifo se-COVID esingenza ukuthi bashone from sona naba breastfeedayo sithi akukho nkinga sithi mabajove nabo ukuze baziprotecte from i-COVID.
Ngiyathemba Dr. Noluthando ukuthi ke labanetindlebe ke sebavile ke ngobumqoka ke bekujova. Let's take our next caller sina Abraham ulapha ke GERMISTON sekumele lihlelweni sawubona.
Yebo sawubona Simthisi.
Siyabonga kakhulu babe kusishayela sicela ukuthi ukhulume nathi what's on your mind?
Yeah, kusho ukuthi sicela kubuta la sithi ukuthi nangifuna kuya eSwatini bengenda le test ye COVID manje sengijovile kusadingeka yini ukuthi ngiteste nangifuna kuya kangwane eSwatini.
Okay, Abraham siyabonga kakhulu ke usishayela sidini into efike titakuchazela kulelo hlangozo kwanyalo ke asesithathe ke likhefu lekugcina please join us after this break. Welcome to our final segment. Sayaqhubeka ke nendaba yethu namhla ke sikhuluma nge-vaccination nekumqoka ke bekujova and we're trying to dispel some of the myths and the untruths and the fake news and the disinformation and the misinformation with regards to vaccination. Now, Jane, we've heard our caller there, Mr. Abraham from GERMISTON. He's saying that he has vaccinated already and he wants to cross the border to the Kingdom of Swaziland. So would he still be required to go for a COVID test and after producing that certificate that he is indeed vaccinated?
So he would have to make sure he's been vaccinated either once with the J&J or twice with the Pfizer. So he would have had to have completed and be fully vaccinated. And then he needs to investigate what the entry requirements are for traveling into another country. So most countries require you to have a COVID negative test. In fact, I don't know any that don't. Every country I know of knows that it requires you to have a COVID negative test. And then you're also required to have a COVID negative test coming back into South Africa. So that would be your responsibility again in terms of testing negative before you go and then returning, having another test to return into South Africa. And it could be that even if you test negative going into another country, you might still have to isolate there. Like if you go to the United Kingdom, you've got to test negative, but you then have to spend 2 weeks in a hotel in a hard lockdown, and to make sure that you are COVID negative before you can go into the UK independently.
Okay. And in a family setting where one member is vaccinated and the other is not, is the entire family at risk?
Yes, I mean, this is, well, everybody is at risk. This is what I'm saying about responsibility. We are all at risk because even vaccinated people can be at risk of getting COVID, but they're not at risk of getting bad COVID or serious COVID. So you could have an example where one member of the family gets COVID and will pass it on to a partner and possibly to the children in the family. So that is possible. Even vaccinated people can get COVID within a family, as can children.
Okay, and in an effort to vaccinate, to get more people to vaccinate, some companies are offering incentives. If you vaccinate and you get a certificate, you get a 10% discount at one of the biggest retail shops in South Africa. What's your thought on this? I mean, is it really, will it get more people to vaccinate?
Look, incentives are being used internationally to get people to vaccinate. And I think we have to try and use everything we can do, whether it's a cash incentive, whether it's an airtime incentive, whether it's a food parcel, whether it's a discount, whether it's a free coffee. Everybody needs to, we all need to try and do as much vaccination, getting as many people vaccinated as possible. And any initiative, I think, is helpful and useful, provided that initiative is in the interest of the person who's receiving the incentive. So an incentive that's going to do harm to you would not be a useful incentive, but an incentive that is healthy or positive will improve your opportunities to either get a vaccine or improve your health or improve the household. Those incentives, I think, should be allowed.
All right, Jane, thank you so much for joining us. Now, Dr. Noluthando, before I let you go, as a parting shot, so what are some of the do's and the don'ts before and after people get vaccinated? So I
think according to kangako abantu bafanele bangayenzi, but it's just that mabeqeda ukuvaccinate siyacela nje ukuthi bangaphuzi kakhulu, balinde ukuthi baqale babheke ama side effects. And then I think siya encourage nje ukuthi abantu bathi make sure ukuthi banawo amapanado abo ukuthi mabesiva kubuhlungu umzimba baphuze bareste, mara otherwise i-vaccination ayinankinga, for most of the people who get vaccinated baba righty. Siya encourage nje ukuthi abantu babe physically active before. It's just for your own immune system ukuthi ube nomzimba already ukuthi vaccinate, but otherwise kufana nokuthi uyojovela okunye nokunye ukuthi vaccinations have been there, like uJane bekhuluma esitsho ukuthi ama vaccinations ayonto intsha. We've been vaccinating. It's just that abantu bayibheka le COVID ingathi into entsha. So ngiyathemba ukuthi abantu bazawahamba bayo vaccinate, bakhusela impilo zabo, bakhusela impilo ze family zabo, bakhusela impilo zabantu base South Africa as a whole.
Dr. Noluthando Nematswerani from Discovery Health and Jane Simmonds from the South African Medical Research Council. Thanks you so much, ladies, for joining us this afternoon. It's been a very, very helpful and a fruitful discussion. We certainly hope that it'll help dispel the myths that are associated with the vaccination drive. Thanks again for joining us. Mugeli, that's how we come to the end of today's show. Ngisasibonga ivakashile namhlanje ngesikhathi ke lebasinike sona ke namhlanje. Ngithanza ukubonga kanye nani ngibabukele ngekuba nathi nangoshela icingo ukuze kube manje. Please join us again next Tuesday for yet another live consumer affairs discussion from Miss Mpiyongcwane and the rest of the team. Sinisale kahle, wishing you all a great week, and please register to vaccinate. Bye-bye.
Awungelakho